Hi, Lisa.
Hi.
Did you get a chance to read the procedure for urine HCG testing?
I did.
Okay, great. Did you take your workday learning quiz?
I did.
And passed it with 100?
Yeah.
Wonderful. We're going to talk about urine HCG testing, the kit that we use to test, and how we run controls and how we run patients. So when we look at this pregnancy test kit, each of the cassettes come in a separately foiled package, and they need to be sealed before you use them, so you don't want them randomly open in the box.
Okay.
So there is HCG conjugate on the pad that the urine will flow across. If HCG is present, the conjugate turns a color. If it's not present, it doesn't turn a color. So that's where we're going to get into positive and negative results.
Sure.
Storage of this is that this kit needs to be kept at room temperature from 50 to 30 degrees Celsius for the duration of its shelf life. So the duration of the shelf life would be this expiration date right here. The specimens that we can use are urine. So the urine specimen must be collected in a clean, dry container, either plastic or glass. Random specimens may be used, however, the first morning urine generally contains the highest concentration of the hormone. A urine sample exhibiting visible precipitates should be centrifuged before testing. So really what this is talking about is if you have a really bloody sample and you can't see through it, it's going to cause a problem interpreting your results here. And if you wanted a result off of that urine, you could still send it to main lab and they could put it through a centrifuge, and then all those particles would go to the bottom and they would test off of what's on the top. But for most all of your urines, you can at least see through them, and they're not going to be disturbing your interpretation. Okay, specimen storage. So you get a urine. Yours are normally clean catch right here in the office. But specimens may be refrigerated 2 to 8 degrees and stored up to 72 hours. So if we ever needed to save a urine and run it later, we could do that following these directions here. If the specimen has been refrigerated, they must be equilibrated to room temperature, which means it has to sit on the counter for about 10 or 15 minutes. So we're going to talk about the procedure. The pouch must be at room temperature before opening, and this is to avoid condensation. Allow the specimen or controls to each equilibrate to room temperature. So these are our controls right here. And when we look at our controls, today we're using MAS UA control. So the MAS UA control level 1 is your negative, and the MAS UA control level 2 is your positive. Right here is where you find your lot numbers and your expiration. So just know that with MAS control or MAS control, once you open them up, they're only good for 6 more weeks. So that's what this date right here written on it is. Someone opened this up, and 6 weeks from that date was this date. Okay? We would check our sample for clarity, our urine sample. We would remove the test device from the protective pouch and lay it on a flat surface. So it's important not to walk around with this while we're running it. We just leave it sit still. We dispense 4 drops for 4 minutes. And we will read that result at 4 minutes. Okay? So negative results, we're going to talk about what a negative result looks like. So when you look at this kit, the negative result will have a line at the C, which means control, and that tells you your cassette worked. You will not have a line at your T for test because there wasn't any HCG present in the urine. So then you don't have a positive result at the T. For the positive results, you will look at the control line has to be there, but the test line will also have to be there. So negative has a control but no test. Positive will have a control and a test. There is a possibility for you to have an invalid test. If there was something wrong with the way the urine flowed across the cassette, or there was something wrong with the cassette itself, and the C line doesn't appear, that means you have to rerun the test all over again on a new cassette. Quality control. External urine controls, both a negative and a positive, need to be run per each box of tests. So when you open this test up, or open this kit up, you'll run QC. One of the ways to identify whether QC has been run on the box or not is here on our log, but also here on the box. You'll notice that another staff member ran QC. She wrote QC OK and the date. This just indicates on the box that it's done, but we still need to indicate our results here on this sheet.
Okay.
So I printed off a new sheet for you to fill out, just so that you know how to do it.
Sure.
When we're looking at this sheet here, you have your lot number of HCG, and that is right there, so we'll write that number here. And the expiration date of the box. This does not change because you've opened a box.
Okay.
One of the other things I want to show you quickly before we move on is that all of the pages following have lot number and expiration date. This document here is for 30 tests. There are 30 tests in this box, and this is kind of how we keep track of how many urine tests have been run on this lot number. So for every kit that you open, every cassette that you open, you have to document here on one of these squares.
Gotcha.
This one is for your positive control, cassette number 1. Cassette number 2 is for your negative control. This is cassette 3, this is cassette 4, this is cassette 5, this is cassette 6. So if you ran cassette 3 on a patient, you will have the date, the patient information, their date of birth, and they're talking about internal QC here. That's that control line. Was your control line okay or was it not okay? And you can see here on the form it says write okay in the internal QC column.
Gotcha.
Here's where you circle what your test result is, and there's where you give your initials.
Okay.
If you ran this on a patient and then on number 4 something happened with the cassette and it didn't work, you still need to document that you ran something on cassette number 4, even if it wasn't on a patient. That's how I keep track of the cassettes. You can just simply write here patient error, and that will be enough to document that this was ran, but we didn't get a valid test from it.
Gotcha.
Okay? So for positive control here, let's put today's date in that box. So remember we said number 1 is your negative and number 2 is your positive, and how I remember number 1 is your negative is because if you turn it this way it's a negative sign.
Gotcha.
Okay.
That's so good.
So let's put today's date.
Alrighty.
And the positive control lot number you found, yes. An expiration date is not, it says date of birth here, but the expiration date is written 6 weeks. And so let's go ahead and set the bottle here, and you can put some gloves on.
Here's one. This I got one.
Mhm.
Go ahead and open it.
Go ahead and open it and lay it flat on the counter. Now you will notice inside the package there's also a dropper. That is for when you're taking sample out of a cup. You'll pull some up into that dropper, and then when we talked about 4 drops for 4 minutes, you would put your 4 drops down, and then you will set your timer for 4 minutes. So you know this test will be for 4 minutes. All right, let's just set that there. Go ahead and glove back up. I'm just going to have you organize your quality control. So you have written your positive information here, and we have our positive vial here. I want you to write the word pause on this kit because we are going to run the positive test on this cassette. And just set it right in front of that. Now let's write all of our information for our negative QC as well.
Okay.
Okay. Open up another kit. This time you're going to write the word neg. If you had a patient to run, your urine cup would have your 2 patient identifiers on it, patient's name and date of birth. Oftentimes, the label is easiest if it's on the cup and it's just set on the cup as a flag. That way you're labeling your specimen cup, and when you want to get rid of your urine specimen cup in regular trash, you can peel that label off easily and throw that away, and they won't be put in the same container. Let's go ahead and run quality control. So you have 4 drops in 4 minutes. So your positive goes in your positive well, and your negative will go in your negative well. The test itself travels across this paper here.
Okay. I need to
Mix it.
agitate this.
Mixing is really important because if you don't mix it from the beginning, by the end of the bottle, your results may vary. That should be good. Straight up and down. Very good. Okay. And then the same for your negative.
Start the time.
And you can start your timer. So limitations of this procedure. Some things that I want you to keep in mind when you're running urine pregnancy tests is that the test provides a presumptive diagnosis for pregnancy. Physicians should evaluate all of the clinical and laboratory findings before making a definitive diagnosis.
Okay.
False negative results can occur on these cassettes. For instance, if a patient's HCG level is less than 20, that cassette is not strong enough to pick it up. And there are also some other disease states that the HCG in a woman's body will still be present.
Okay.
We're going to talk about expected results. Negative results are expected in healthy, non-pregnant women and healthy men. Healthy, pregnant women should have HCG present. And this, again, this test can detect HCG levels as low as 20.
Okay.
The test results themselves, positives can be read as soon as they turn positive. You do not need to wait the full 4 minutes. Negative results must wait the whole 4 minutes.
Okay.
Sometimes these lines are hard to see, so waiting the full 4 minutes is important.
Okay.
So we're at our 4 minutes. Go ahead and stop your timer. Okay. Your negative result right here, you should have a control line and a test line. Is that, or a control line and no test line? Is that what you have?
Correct.
So what result is that?
Negative.
Negative. So right here on this, you're going to say, was your internal QC okay?
Yes.
Okay, write the word okay there. And then circle the result of your negative control. Now let's look at your positive control. You have a line at your control line and a line at your test line.
Mm-hmm.
So is that a positive test or a negative test?
Positive.
Positive. Did your internal QC work?
Yes, it did.
So let's go ahead and document that. Now with patients, you'll just proceed with the dates that you do the test, each person's 2 patient identifiers, expiration date, or date of birth, internal QC okay, positive, negative, and your initials.
Okay.
When you run a test and we document it here, it still has to go into their Epic chart through Enter Edit.
Okay.
Any questions about this?
I don't think so.
Okay, great.
It's pretty simple.
So we're going to talk about this document here. You have your name, your employee number, and the date at the top.
Mm-hmm.
And then you are going to put the date and your initials next to each one of these standards that we've talked about today.
Mm-hmm.
And I will put my initial in the box that says that I've trained you on all of these standards. records. Do you have any questions? We'll sign in, both of us will sign and date at the bottom.
Great.
Thank you.
All right.